In a trauma bay, every second count. Imagine a patient who just arrived at or after a motor vehicle accident, hypotensive, on the verge of cardiogenic shock. What is your next step? The FAST exam is one of the most powerful tools in trauma care, and it could save the patient's life. But how does it work? When do you use it? And why is it crucial for the USMLE Step 3? Stick around, and in just 15 minutes, I will give you everything you need to know to master this high-yield topic. Welcome back to the channel. I'm Dr. Sara Ahmed, an internal medicine and hospitalist provider, creating a series intended to help USMLE Step 3 candidates understand and easily manage high-yield material. Today, we are talking about the FAST exam, which is an acronym for Focused Assessment with Sonography in Trauma. This is a rapid bedside tool that helps identify life-threatening injuries in trauma patients, like pericardial tamponade, hemoperitoneum, and hemothorax. A must-know concept for the USMLE Step 3, because it's not only testable in multiple choice questions, but also essential for clinical case scenarios, CCS. By the end of this video, you will know the what, how, when, where, and why of the FAST exam. So whether you are dealing with a USMLE Step 3 trauma vignette or managing a real-life scenario in trauma bay, you will be ready to act. Let's start with the basics. What is the FAST exam? The FAST exam, or Focused Assessment with Sonography in Trauma, is a quick bedside ultrasound used to detect free fluid or air in critical areas of the body. Specifically, it examines 4 zones: the pericardium, the perihepatic or Morrison pouch, the perisplenic space, and the pelvis. There is also an extended version called the E-FAST, which includes the thorax to assess for pneumothorax or hemothorax. Why is it important? Because in trauma, identifying injuries like hemoperitoneum or pericardial effusion early can be the difference between life and death. And on Step 3, you will see this concept tested in the trauma algorithms and CCS cases. So how is the FAST exam done? It's performed using an ultrasound probe placed on key areas of the patient's body, starting with a pericardium to check for pericardial effusion. When the probe is moved to the right upper quadrant to assess Morrison pouch, then to the left upper quadrant for the splenic space, and finally the pelvis for free fluid. If positive findings are detected, fluid in the abdomen or fluid in the heart or around the heart This indicates a serious injury, such as rupture or tamponade, requiring immediate intervention, like laparotomy. So when do we use the FAST exam? It's performed within the primary survey of trauma patients, especially under the C part of the ABCD of trauma care, the circulation. If a patient has signs of shock, like hypotension or tachycardia, the FAST exam is used to quickly assess for internal bleeding or other life-threatening conditions. For instance, if a patient involved in a motor vehicle collision presents with hypotension, tachycardia, and a distended abdomen, the exam can help identify hemoperitoneum and guide the next steps, whether that's laparotomy or stabilizing the patient before further imaging. Now, let's talk about where is the FAST exam performed. This is a bedside tool designed for use in trauma bays, emergency departments, and even pre-hospital settings like ambulances or helicopters. Its portability and speed make it ideal for any situation where rapid assessment is critical. Globally, the exam is especially valuable in resource-limited settings where access to advanced imaging like CT scans may be delayed or unavailable. This makes it a universal tool for care. Finally, why is the FAST exam so important? Clinically, it's a life-saving tool that allows you to prioritize interventions for rapidly fatal injuries like tamponade or hemoperitoneum but on the step 3, it's a high-yield topic because it tests your ability to think critically and quickly in trauma scenarios. For example, a step 3 question might describe a trauma patient with hypotension and tachycardia after a car accident. If the FAST exam shows fluid in Morrison's pouch, you will need to recognize that this indicates hemoperitoneum requiring emergent laparotomy. Missing this step could mean an incorrect answer and in real life, a lost patient. To recap, the FAST exam is a rapid bedside ultrasound that checks for key zones for free fluid and air in a trauma patient. It's performed during the primary survey, especially in patients with signs of shock, to quickly identify life-threatening injuries. Its portability and speed make it invaluable in trauma care worldwide. And it's a must-know for the USMLE Step 3. If you are preparing for Step 3, make sure to practice interpreting ultrasound findings and review trauma algorithms. You will likely see this in the exam. And remember, mastering the exam isn't just about passing Step 3, it's about saving lives. If you found this video helpful, don't forget to like, subscribe, and share it with your fellow Step 3 takers. Let me know in the comments what other trauma-related topics or high-yield concepts for the Step 3 you would like me to cover. And don't miss our next video where we will tackle another critical Step 3 concept. See you next time.